now? Well, most, if not all of the schools have started back to the autumn term. You are still facing many of the same challenges in relation to social distancing, adherence to the rules, and risk assessments. But now most of you now have a host of new challenges to overcome. The reintroduction of breakfast clubs, new rules on face coverings, local lockdowns, as we have seen in Caerphilly already, and we will see in RCT from tomorrow, as well as the challenges with funding and, of course, the test, track and trace process. Last week, NAHT Cymru called for school staff displaying symptoms to be made priority for testing or risk schools closures because of staffing shortages. NAHT has been inundated with your calls and emails, and in a bid to address your concerns as quickly and efficiently as possible, we've convened this panel event this evening. Officials from the Welsh Government and Public Health Wales are on hand to help with those issues. In a bid to tackle another growing concern of yours relating to the consortia and request from challenge advisors for meetings, we are in the process of writing to 4 consortia in Wales, urging them to listen to the pleas of NAHT Cymru to stop their demands. The demands for meetings, for school development plans, accelerated learning plans, and whatever other plans they may wish to discuss with you need to be put on hold for the time being. School leaders' focus at the moment must remain on the operational leadership of schools, with many of you spending hours bringing children, staff, parents in and out of school safely every day until the new processes have a chance to bed in. Now is not the time for the consortia to pile on additional pressure. Schools need support and space. Teaching and learning are crucial, of course, but safety is of paramount importance. We hope they listen, but we have warned them that we intend to take matters further if they persist in this current course of action. Your well-being is at the top of our agenda. Over the coming days and weeks, we will be bringing members together with their branches to offer support. You have received our guidance emails. Use them, get in touch when you need to, and ignore us when you don't need us. You'll focus on what you have to do, and we will continue to work behind the scenes to support you. Thank you for joining us.
Thank you very much, Laura. Now, I'm going to pass over to the Welsh Government officials that have joined us. Unfortunately, we are having technical issues. We haven't been able to be joined yet by Steve Davis. And I understand that he did want to sort of make a start in the proceedings. So what I'm going to do is just throw this first question out to whoever is ready to start the Q&A with me. I'm going to ask, as I said, the questions that have first of all been submitted in advance, and then we'll move on to the questions that have been submitted throughout the evening. So the first question: when will the Minister for Education acknowledge the crisis in schools and make a public statement?
Hi, Laura. I'll pick that up. I know this is something that Steve wanted to very much to pick up on. I think what we'd like to really flag is the work that we're doing around the coronavirus control plan. And obviously the First Minister launched a plan. What we're doing now within education is looking to develop something very specific to support that and work underneath that. So the coronavirus plan, obviously that sets out the sort of the 5 likely stages that we may be going through. So there's the prevention, new cases and clusters, incidents and outbreaks, local regional measures and national measures as well. So there is very much a plan and a process in place. Obviously, there's been the local measures within Caerphilly and now RCT, and we know predominantly they're in the sort of incidents and outbreaks, and they're taking on local measures. So there is a plan and approach in place, and obviously we've been working very closely as well with particularly Caerphilly and with Newport as well, and we've been learning lessons from the experience of both Newport and Caerphilly, and we'll be learning lessons from the other local authorities and other schools as well. So I think that in terms of the question, we have got a plan. We are working with key partners and stakeholders, and it is a steep learning curve, and we are working as quickly as we can as well to get answers to some of the queries that have been coming through. But it is very much a collaborative approach and something we need to do in partnership as well.
Okay, so it's difficult to kind of say when there would necessarily be a statement then in answer to that question, but thank you, Ruth.
Yeah, sorry, and I think at this point in time, we don't view, I mean, in terms of the language, we don't view that there's a crisis. Obviously, there are outbreaks, and it is an anxious time and a concerning time for individuals. But I think that in terms of making a statement, we've got a clear plan. We will be publishing, as I mentioned, the control plan for education to support the work that's already being done. So I think that at the moment there isn't a plan to make a specific announcement in regards to crisis, because we don't see that there is a crisis at the moment.
Thank you. Okay. The next question on the list was, what is the current number of COVID-19 cases within Welsh schools?
Okay, me again. In terms of the sort of data and information, that is something that we're working with local authorities on. We're also working with colleagues in Public Health Wales, so we can gather intelligence, but it's not just about the data in isolation, it's very much the context and understanding. So obviously there will be, and we'll all have seen the coverage, and obviously you'll have heads who will have experienced this firsthand. So we are looking to understand where the cases are, what that has meant then in terms of the numbers who are self-isolating as well, because we're conscious of the fact that in some schools that has meant, you know, a small number of learners, say a class of 30, and in others it's had a far greater impact in that it's been whole year groups. So we are looking to gather intelligence and data, and we are looking then to how we can work with yourselves and local authorities and, as I mentioned, Public Health Wales, to see how we can use that data. It's changing on a daily basis. So I think that's the other thing to note as well. There is some information will be published, obviously, on Public Health Wales website. But in terms of the data that you're referring to, that is something that we are looking at, but it is moving and it does keep changing. But the context, I think, is very important in understanding that.
Okay, thank you. So I don't know, well, this one maybe will be a little bit more straightforward. How many schools in Wales have classes closed due to COVID-19?
That's what we're working with local authorities to gather that information together. And as I said, obviously we'll have notifications through, we'll have an understanding of the number of individuals that might have been tested positive. But in terms of the impact, it's varying from school to school. So we're looking to put in place a process with local authorities that when they are notified, that we get notification as well. Because what we want to do is understand what impact it's having on learners. And one of the areas that we've had mentioned to us is about the impact on those who might be preparing for exams, for example. So we do need to understand what measures are being put in place in terms of the contact groups. So that's something we're working with colleagues in Public Health Wales and internally to understand more about the numbers that are going into self-isolation and whether or not it's proportionate in terms of what we should be doing.
Okay, thank you, Ruth. The next question is about attendance then, and it asks, will parents or carers who choose to keep their children at home during localised lockdowns be issued with fines? I mean, the short answer is that's not our expectation. We've published a frequently asked question on this, which sets out basically the Welsh Government's view is that it would not be appropriate for a local authority or school to issue a fixed penalty notice or commence proceedings for non-attendance. We're going to obviously monitor the situation over the first half term before reviewing the position, but that's our position at the moment. Okay, thank you for clarifying. Before I move on to the next question, just to say to people who are entering questions in the chat function, if you can please make sure that they go into the Q&A section, because that will allow your colleagues to vote for their most popular choices, which will then be put to the panellists. Right, so the next question, this is moving on to test, trace and protect. Do Welsh Government accept that the approach taken to open schools based on the successful TTP system and falling R rate is now flawed? We have a failing TTP system and increasing R rate. Surely Welsh Government need to review their approach to schools function immediately.
So perhaps I could come in and begin. So noswaith pawb, good evening everyone. I'm Joanne Daniels. I'm the Director with Responsibility for Test, Trace, Protect in Welsh Government. The Test, Trace, Protect programme was initiated on the 1st of June. It's a collaborative arrangement between health boards, Public Health Wales, Welsh Government, NWIS, and critically local authorities as well, who operationalise the contact tracing element in particular. Apologies. Since the Test, Trace, Protect system has been operational, we've been able to develop across Wales a network of testing sites, a range of drive-throughs. There are some community testing units, and people obviously also have the opportunity to access home testing kits. We've seen the performance of testing through that time improve dramatically, both in terms of people's accessibility and in terms of the turnaround times, the speed with which the test results have been coming back to individuals. So over the summer, we've seen in excess of 90% of test turnarounds being achieved within 24 hours. In terms of contact tracing, I have to say all credit to local authorities and health boards. The speed with which they established those contact tracing teams was hugely impressive. They've utilised staff from across the local authority, many of whom were unable to fulfil their proper roles. So people from libraries, people from leisure centres. No doubt there will have been some school staff involved as well. And they have worked tirelessly to put in place systems to ensure that we can contact trace the identified close contacts of those who test positive. The contact tracing performance, just to give you an indication, shows us from the statistics we publish, and we publish them every week, so they're there to be scrutinised. Between the 21st of June and the current time, we've identified 1,897 positive cases. 98% of those have been followed up and contacted by a contact tracer. We've identified 6,194 contacts, and 94% of those have been followed up and had contact and a conversation with a contact tracer, advising them to self-isolate for 14 days. Our system has been working extremely well since its inception on the 1st of June. Now, clearly, over the last week or so, we have faced some challenges. So just on the testing front to start with, as I mentioned, the testing network, which is partly Public Health Wales, but predominantly the Lighthouse Labs, has suffered challenges with the Lighthouse Lab capacity coming under strain. To give you an indication, within Wales, from the 31st of August, the week commencing 31st of August, there were 45,304 tests conducted in Wales. From the 7th of September, the week commencing, there were 63,836 tests undertaken within Wales. So that's nearly 20,000 more tests in that week than the previous week. That's a very significant increase, which has been replicated across much of the UK, and combined with some delays in additional Lighthouse Lab capacity coming on stream that were expected, but for various reasons haven't manifested, we've found ourselves in the position where demand is currently exceeding supply. And I'm really sorry that there are colleagues of yours, friends of yours, families of yours who are struggling to get a test and are finding that a really anxious time. So we've been taking steps to make sure that we can utilise our Public Health Wales capacity. In a sense, we're in a fortunate position that we don't have all our eggs in one basket. We are not wholly dependent on the Lighthouse Labs. So we've been working with colleagues in health boards to ensure that we can expand access to the Public Health Wales system, and obviously with Public Health Wales colleagues as well. That's not going to happen overnight. It's not as simple as switching. There are some technical issues that I won't bore you about 2 swabs versus 1 swab, dry swabs versus wet swabs. I'm sure you don't want to know the finer details of the things that get stuck up your nose and down the back of your throat. But there are some technical challenges and logistical challenges in making that switch, which means we can't do it at the flick of a button. So it will take time. Please bear with us, but we are doing everything we can to increase the availability of testing. And we are working with DHSC and our UK government colleagues in the same way. And we are, and you will have seen, no doubt, from the press coverage that the issue of test availability is very, very high up on the agenda. There have been a number of ministerial discussions on this, and we are being reassured that action is being taken. Sorry, I appreciate that I'm going on a little bit, but I just want to say a little bit about contact tracing. So prior to schools returning, yourselves, local authority colleagues, Public Health Wales colleagues, colleagues in Welsh Government spent a lot of time thinking, planning, preparing, producing guidance on how contact tracing will work in the context of schools and any cases that might arise. Inevitably, despite all the planning, despite all the thinking that went into it, despite the extensive guidance, we are inevitably finding some issues, shall we say, in operationalising it. And it's really important that we stay joined together in this endeavour to limit the spread of transmission, and that we continue to work together to make that contact tracing operation work for schools. And we're committed to try and do that in the best way we can. I've got several pages in front of me of comments, feedback that we've had from schools, identifying some of the issues that you've faced, and we want to work through those and make sure that we can adapt our contact tracing system, which, as I say, over the summer has been performing extremely well in terms of its routine operations, and we want to see it working just as well for you as head teachers and for your classroom and staff colleagues. So it's really important that we keep that conversation. I'm sure Julie might want to say more.
Thank you. I'll go to Julie and then I'll go to Laura, who I know would also like to feedback on this as well. So Julie, thank you.
Thanks, Joanne. So I'm Julie Bishop. I'm one of the my day job is the Director of Health Improvement at Public Health Wales, but like most of my colleagues, I'm involved in supporting the COVID response. And I think really just picking up on some of the things that Joanne said, we are seeing unprecedented demand, and some of that, not all of it, some of that is being driven by people looking for tests who don't actually need to be tested. And so one of the things that we're working quite hard on at the moment is to try and help clarify when a test is needed and when it isn't. So some of the things that, for example, I think we're all coming across, and I'm sure will be familiar to you, is the challenges that parents and others find in distinguishing between a normal cold and coronavirus. For one, we need somebody to get tested; for the other, we don't. So just a simple runny nose isn't something that needs a coronavirus test. Similarly, what we're seeing is quite a lot of demand for testing of contacts. So at the moment, our emphasis is very much on making sure that anybody that has symptoms gets a test. What we're seeing is a lot of people who've been asked to isolate because they've been a contact of a case, wanting to get tested themselves. And whilst on one level I can understand that, I think we can all understand that, it actually really doesn't help unless they themselves become symptomatic when they should be tested. They actually have to isolate for the period, for the 14 days in line with the guidance, and having a test doesn't change that, even if that test comes back as negative. So I think part of the collective responsibility we've all got is to try and help make sure that we use that testing capacity that we have got as effectively as possible, so that actually means that those who really need it, such as some of those staff that you've got who are symptomatic, can actually get it as quickly as possible.
Thank you, Julie. Laura, would you like to come in on that?
Yeah, just wanted to pick up on the point that Joanna and Julie has then gone on to make around capacity. It's great to hear that the process was working throughout August and that the labs were able to turn around the results quickly. However, it should not have come as a shock that come school return, there was going to be an increase in demand. I think certainly from our members' perspective, the worry, stress, anxiety that they are having to deal with, not only their own personal circumstances, but the circumstances of their staff, the circumstances of parents, is overwhelming. And I have to say I am disappointed that it wasn't anticipated that there was going to be this increase in demand. As soon as you start to put the school communities together, you are always going to have, with the best will in the world, with all the risk assessments and all the processes in place that we as NAHT and our members have supported, you were always going to get an increase in demand, because it was a return to what is the new normal, and you're going to get people coming together. So I am disappointed that that this wasn't anticipated, although I am hopeful that further investment in the process will mean that we see these test syndromes run more quickly. One other point I wanted to make very quickly around the contact tracing element, and this is something that may have been brought up in the chat function since we started, is the element around the role of a head teacher in the track and trace process. So obviously, head teacher holds a significant amount of responsibility and information that will be, crucial to the track and trace process. Having said that, having head teachers on call 24/7 to respond, as much as they want to, and as much as they are doing, and as much as, quite frankly, they're not really complaining about it, but as their representative, I feel I have a duty of care towards them and their well-being to mention that that is not a sustainable process going forward. We've already raised this with Welsh Government, and Welsh Government have been sympathetic to the concerns of our members around their well-being. But I think an alternative, another process, I don't know how that would work, to head teachers being on call 24/7 needs to be looked at, because as we've said often, this is a marathon, not a sprint. This isn't going to change anytime soon. We're all hopeful that it would be done and dusted by Christmas, but that is clearly not going to be the case. And I think going forward, if we are to remain supportive as we are, return of children to school and getting into what is the new normal, those processes of testing and the support for head teachers needs to be there, because quite frankly, the profession is at breaking point.
Thank you, Laura. And actually that was the next question that I was going to come to, which had already been put forward, was about an exact example of somebody who, the head teacher who was on call, they received a call at 9 p.m. on a Sunday evening. So just sort of to add to what Laura has just said, the question describes that situation and then it asks, do Welsh Government agree that this is not reasonable or sustainable?
Shall I start with that one and talk about it from a public health point of view, and then perhaps my Welsh Government colleagues will add to it. I think that scenario is a very rare event. So the test, trace and protect teams, generally speaking, work until 8 p.m. Now, their task, and the reason they will have made that contact, is because they would have wanted to try and avoid children and young people coming into school who were contacts and could potentially infect others. And unfortunately, the person they would have had to contact, because that's probably the contact that they had, would have been the head teacher. So I think there are clearly, that's a huge ask, and I think we understand that. But I think we also have to recognise that the environment that we're all working in is asking exceptional things of all of us. So I think talking about 24/7 probably isn't very helpful, because nobody's going to be contacting any head teacher at 2 o'clock in the morning. And there are people in other parts of the system who have genuinely been working 24/7 since January on this response. And, we perhaps need to make sure that, there is that collective understanding of what the contribution is that everybody has been making to this process, which isn't about trying to underplay the very difficult circumstances that we know schools are finding themselves in, and head teachers in particular. We have worked out, as Joanne said, that despite the best planning, the clarity around how to respond to a positive test in a school and what should actually happen and who should provide support to the school in helping to make the best decisions as quickly as possible isn't as clear as we would like it to be. And certainly we know from the contact that we're getting in Public Health Wales, there are a lot of head teachers who are really struggling to get help to understand what to do. And that's something that we are working very closely with colleagues on at the moment to try and get really clear guidance out to every school in Wales that they know what they're supposed to do and who they're supposed to contact when they become aware of a positive case, either amongst the pupil or a member of staff. And then the help that's needed in terms of how you do that contact tracing is going to be made available more quickly. So I think, you know, just to reassure people, I don't think you can expect to be contacted late at night or routinely on weekends in order to respond to that. But we probably need to talk about the best way of actually getting access to that contact information, because the school is the place it's going to be held. So in practice, it's very difficult to think of an alternative than contacting the head teacher, which is what we would do if we had a case of another serious infectious disease like meningitis in normal times.
Thank you, Julie. I appreciate your comments. I just do hope that some local authorities are listening to that, because we have had calls from members indicating that they've actually been insisting that head teachers are available 24/7. So that's very helpful. Thank you. The next question actually goes on to say about home testing. So are Welsh Government or Public Health Wales aware that there are no home tests available, and how are they responding to this? Monday the 14th of September, no home testing available. An example given of a child in Caerphilly with a cold and temperature who was advised to attend a testing station in either Aberystwyth or Warwickshire, and another child in Neath being told to travel to Aberystwyth or Haverfordwest. Do you feel that this is acceptable, given the situation particularly that Caerphilly is currently in? So this would have been before the latest update about the other local lockdown there. And this is delaying schools being able to close classes in a timely manner in order to prevent the virus spreading. So the question is, do you think that's acceptable, that people are being asked to travel those distances for testing?
So I'm happy to try to respond. Of course, it's not ideal if people have to travel long distances, particularly if they're feeling unwell. There has since Monday, I believe, been introduced on the UK government website a limit of 75 miles within which you can now book a test. So people won't be directed towards far distant venues. There is a glitch in the system where it doesn't recognise the sea. So it measures 75 miles as the crow flies. And so that will account for why some people from Devon have been told to go to testing sites in Carmarthen and vice versa. So that is a known glitch that they're trying to resolve. In terms of access within Caerphilly, there were two testing sites set up in Caerphilly. One, I believe, was Caerphilly Leisure Centre. The other one was Penalta Park. Both of those were walk-in centres that didn't require booking, that were not linked to the UK government portal. So those sites were accessible to the community. They have been for over the last week, and I think one of them continues to be available. The other one is being closed because they feel that it's not needed at the moment. And there's another site being opened in Tredegar in Caerphilly instead. Similarly, at the weekend there was testing available in Porth in the Rhondda. Again, that was walk-in testing alongside bookable tests, and so it is possible, and we have prioritised those areas that are showing increased incidence of COVID cases for testing. In terms of home testing, I hope most of your colleagues will be aware that we have made a limited number of home testing kits available for schools to distribute in case they are the only option. And so obviously that's there to use. The fact that home testing is limited is a broader reflection of the issues that I've already touched on. All home testing is undertaken through the Lighthouse Lab network. We don't have the option to switch home testing over to Public Health Wales laboratories. So that, as I say, the issues there are interlinked with those that I've already touched on.
Thank you, Joanne. Is anybody able to say what the current daily COVID-19 testing capacity is in Wales?
Sorry, could you just repeat that question?
Sorry, yeah, what's the current daily COVID-19 testing capacity in Wales?
If you give me 2 secs, I will look up for you the figure that was tested over the last 24 hours. If you go on to something else, and I'll come back.
Okay, thank you for that. So we have a question here. I'm just thinking about whether some of these have been answered already. It's difficult. There's a lot of that. That's the most popular sort of topic of the questions that came through in advance, was the testing, trace and protect. But I think I'll go on to this final question in that section, which says, are staff supposed to now be doing 3 jobs, teaching their class, providing home learning and cleaners? We have to be very mindful of workload at this stressful time, particularly if more children are going to be isolating for 10 days rather than having a quick test result. Just, I don't know who'd like to comment on that one.
My apologies, because I was looking at the figures. So in the 24 hours to, let me just make sure I get the dates right. So in the 24 hours to midday or 1 p.m. yesterday, there were 9,831 tests processed for residents in Wales. So close to 10,000 tests processed. Just under 3,000 of those were processed through the Public Health Wales laboratory system, and just over 7,000 published through the Lighthouse Lab network. So that gives you an indication, as they, of the sort of volume of testing, despite the constraints that we're facing, that the system is still managing to throughput.
Thank you, Joanne. Steve Davis, we've managed to, you've managed to get through. I don't know whether you heard the last question that I read, whether you would maybe be well placed to respond to that, if you'd like me to repeat it at all. Are you on mute at the moment, Steve? There you go. Okay, might want to just come back to you in a moment. I'll read the question out again, Steve, if you can try and just see if you're able to unmute. Are staff supposed to now be doing 3 jobs, teaching their class, providing home learning and cleaners? We have to be very mindful of workload at this stressful time, particularly if more children are going to be isolating for 10 days rather than just having a quick test or result.
Okay, I think I'm with you now.
Yeah, thank you.
Okay. Well, yeah, thank you. And again, apologies for delaying getting through. The technology didn't work. Well, I certainly wouldn't be advocating teachers doing cleaning. On the other 2 tasks, I think there are really good examples across Wales and more broadly internationally that we can see of schools being able to deliver the blended learning. That is, cater for children who are not able to be in school. At the same time, we recognise that there are different patterns emerging now to that which had happened in the summer, and we're actually having larger blocks of children, sometimes teaching groups in primary schools or subject groups in secondary schools, and the pattern of having effectively 10 school days off lends itself to potentially teaching larger groups. We're not looking to dictate that. What we are doing is recognizing we can't honestly, and I don't think the profession would want to, accept that we won't be providing learning for the pupils of that type. I think there are real challenges when it comes down to individual pupils, particularly if they're away for a short number of days, so we need to be realistic. We are consulting currently, and we'll be consulting with the unions tomorrow, so Laura will be there, where we are consulting on a learning expectations document, which sets out the approaches to the delivery of the curriculum, but also approaches to the delivery of blended learning. It is not intended to be dictatorial. It is intended to be enabling. It sets some parameters to try to be helpful, and it allows and sets a framework for schools to be clear as to how they are going to or want to approach this challenge of catering for pupils in school as well as out of school. And I'm not looking, and we have to find ways, and there are ways out there that are working very effectively at the moment, where through effective use of time where that can be the balance. But we cannot have teachers teaching all day flat out and working all night setting work. And said in good examples across Wales and more broadly in the UK, there's examples that we can pull from. And the other thing to stress, and it's good to have the opportunity through this forum to do it. I recognise that head teachers and teachers are struggling with the immediacy of the challenges they're facing. But I want to remind people that the 29, almost 30 million pounds worth of resource going out to look to recruit additional staff to support in this area, particularly in secondary schools where they're potentially working with pupils at GCSE and A levels. The resource not necessarily to deliver that, but to look to release. I do recognise that in the smaller schools, it will require putting that amount of money together to pool to get that additionality of resource. But I wouldn't underestimate the capacity to use that resource. And the challenge is, the longer we leave it to actually go through the recruitment process, the less time that we have for those additional teachers or support staff to help in this area. So I'd encourage and urge head teachers to look at that resource, to work creatively with local authorities and regions to identify ways in which you can advertise and secure teachers, some of whom would have left university in the summer. Others might be teachers who would be in the supply pool. Others would be teaching assistants. But it's not an insignificant amount of resource. And I'd want head teachers to be looking creatively at that in terms of the use of that resource, particularly, as I said, to support the use of blended learning.
Thank you, Steve. Now I realise we actually did have a lot more questions that were put through in advance, and we're going to run out of time to go through some of the questions that have been submitted this evening. So as I said at the beginning of the evening's broadcast, we will obviously be making sure that those are all addressed, and all your colleagues from Welsh Government and Public Health Wales will be able to address those, and we'll feed them back to the members. But we have had other questions that have been put through, and I'm conscious of the fact that we will run out of time to ask any of them if I don't start now. So I'm just going to take a couple of those, and all of those that we don't cover will also be fed back on as well at some point. The first question had 25 people vote for it, and it asks, is there any truth in the speculation that there may be discussions ongoing to review term dates for 2020-21, specifically the October half term?
I can handle that one.
Thanks, Steve.
The answer is no. The answer is no. The legal arrangements for establishing half-term holidays and breaks are set where the local authority have to apply to the minister and propose the number of days that are going to be committed to a particular term. And we wrote to 22 local authorities offering them the opportunity to do that. Those local authorities who took that opportunity, the minister signed off the agreement that in those authorities, though the changes to the term dates will stand clearly for the autumn term. There's no intention or discussion in terms of widening that opportunity, because to give the teachers the extra week off in the autumn would not allow the system to meet the regulations. So it's that one's pretty straightforward. So I can see why 25. I'm surprised it's not more than 25 who would want to vote for the extra week, but it is set, and the process is a legal one. And I say all 22 local authorities were given the opportunity to make that decision, and those who made the decision, the term dates will stand with the 2-week break in the autumn.
Thank you. Okay, so the next question on the list, and I think this will probably have to be the last one before we hear from Ruth Davis. The next question is has 23 votes. It says a parent had the advice from 111 to resend their child to school despite having shown symptoms as there were no tests available. How does this keep us as teachers safe? Sorry, I don't know who'd like to come in there.
Will I take that one?
Thank you.
I mean, that was not correct advice. If the child was symptomatic of coronavirus, then they should have been isolated at home and not gone to school. The absence of tests being available isn't the issue. The issue is the isolation, and I think that goes back to the confusion that we're seeing really about the role of testing in all of this. Testing doesn't actually protect anybody from anything. It helps us understand that somebody has this infection, but actually what protects people, apart from the preventative measures that we're all familiar with, is actually isolation. So that child not being in school was the protective measure. And so it's unfortunate that that advice was given, if that was the case.
Thank you, Julie. And I know I did say that was the last question, but I would like to bring in Chris Jones, Deputy Chief Medical Officer, if possible. We have got a question which we've had 18 votes on. Quite a, well, very timely question, considering all the recent changes. Is the face coverings guidance for primary schools going to be revised and made clear?
Yes, well, thank you very much for addressing this question at me. Makes me feel that I've been able to participate. I mean, the face coverings advice, well, I don't know of any reason why it would need to be revised, but all of the guidance that we put out is continually subject to review and revision. Just as a general remark about that, one thing that has always been a characteristic of this pandemic is it's been changing all the time. So guidance and advice, in many fronts is evolving. But the face coverings advice for primary schools is that children in primary schools generally will not be expected to wear face coverings. Teachers should wear face coverings in communal areas if they can't self-isolate. That is now a legal requirement. Actually, that's still a recommendation, isn't it? Because schools are not public places. But I don't know of any reason why the guidance would need to be amended. Is anybody able to explain the question?
I don't have the background to the question. I don't know if any of my colleagues might, but
I think what
a message in the bar saying, it's just Heather here, a message saying that it is confusing at year 6, I think, isn't it? Because it talks about 11-year-olds, but I think Steve could clarify that. I'd just like to make one additional point as well to support Julie's point on the previous question. Certainly if that advice was given, it was wrong advice, but symptoms may not be core COVID symptoms. And that's one of the issues that we are actively dealing with in trying to get people to understand what really does need a test, the 3 core symptoms, and what doesn't, which is the colds and sniffles. So that might be a misunderstanding of actual symptoms, but it's only core COVID symptoms which should be tested. Thank you.
thank you.
Hi, just on the face masks, I think there is some confusion, and I did try to square it, but it was right at the end when the rules changed, and it was about 12:25 before the First Minister was going on. The guidance for schools talks about primary and secondary pupils. I believe the guidance for wearing face coverings outside actually still uses the 11-year-olds, so we could see some confusion there. I am also aware that under some pressure, some schools and some local authorities have looked to extend it to give confidence to parents that their children are safer in that environment. I don't envisage, in the light of the medical advice that we're getting, that we would be advocating for children to do that. If I had been here for the first response, and apologies again, I was going to talk a little bit about proportionality. And if we look to apply all of the constraints at a very early stage, you do not have the opportunity to look to use those strategies as you go forward. But even given that, we're still in a position where we're not envisaging we are envisaging looking at some of the details of guidance on face coverings, but currently looking to recommend their use in primary schools is not on our agenda.
Okay, thank you, Steve. I'm going to end the questions there. Then, as I said, they will all be looked at and fed back on. Just we are getting closer to our finish time. So briefly, please, if I could just bring in Ruth Davis, our president.
Can you hear me okay?
Yeah.
Yep.
Thank you. Well, thank you everyone for giving your time again this evening and joining us in such numbers. It's reassuring and it reminds us of the great network that we ultimately are supported by. Too often this job is a lonely one. No matter how strong your staff are, no matter how strong your leadership teams are, ultimately the only people who can truly empathise with the dilemmas that we face daily are others doing exactly the same thing. And so the chance to meet and engage at events like this evening's and to meet so productively as well is at once reassuring and energising. NAHT Cymru is all about communication. Communication is essential if we are to be able to robustly and purposefully pursue the issues affecting you on your behalf, and on your behalf with both local as well as national administrations. An hour or so ago, your branch representatives met for NAHT Cymru's weekly panel discussion around the issues currently affecting you the most. As you'd expect, many action points emerging centred around quality and consistency of local authority support, especially around HR queries as well as the role and the support needed from the middle tier working. You are being faced with decisions you simply can't be expected to make on your own. When lockdown first happened in March, and our schools were repurposed, the seeming mantra being rolled out both nationally as well as locally at the time was, "We're in this together." Well, that mantra soon seemed to wear a little thin, and for many of us, it hasn't always felt like we were in this together. The situation since returning to school a few weeks ago has demonstrated this is not a one-person job, and to expect school leaders to shoulder the burden and shoulder it 24/7 is neither realistic, it's not sustainable, and it's not safe. I can reassure my fellow panellists that the school leaders of Wales have at no time underestimated the scale of response required of them. They have literally held our communities together. Our members and my colleagues are all too familiar with the reality of a 24/7 level of availability this has required. For us all, it has surely been the most testing 6 months of our careers. With each decision has come with new questions, new challenges, most of which fell outside our skills and knowledge base. But this is a really important, but we have stayed the course. As how our local and national administrations have made U-turns and changed advice and offered the wrong advice sometimes, or sometimes done nothing at all, we have stayed the course. And why have we managed it? Because we've kept our eye on the goal, on our core business. We feel our responsibility to learners keenly. We take it seriously. And through all the fear and the exhaustion and the confusion, and let's face it, at times utter despair, we've kept our eyes fixed on the needs of the learner. The tabloids may not have been fair to us at times, and communities have sometimes been quick to judge, but ultimately, to whom have parents and families turned in their hour of need? It's been you. As I've said previously, you've literally held communities together, held them together at a time when so many of you will have been bogged down with your own personal circumstances, challenges and worries too. As I said, our national and our local administrations have all got it wrong at times, but in all of this, we've maintained a consistency of message and support. We've held things together, we've worried about PPE, we've been concerned about the advantage gap being widened by a lack of equal access to resources needed for home learning. We've moved heaven and earth to make sure our learners have been fed, and when the most vulnerable have made it through the times safely. You've joined up with other agencies who perhaps weren't talking with each other as they needed to, and you've transformed your schools, firstly into emergency childcare settings, and latterly into safe learning environments for them to return to. The list goes on, and more often than not, you've achieved this by yourselves, and sometimes in spite of and not because of administrations. And then, as of a couple of weeks ago, against a backdrop of late changes, you've opened your gates and put on the all is well smile and welcomed them back. Truly nothing short of phenomenal. Who knows what the ensuing months will bring? Undoubtedly, we will look ahead to even more challenging times as you face likely struggles to staff your schools in the event of individuals becoming unwell or displaying symptoms. There are likely to be local lockdowns which have the potential to raise even more concerns about equity of opportunity than the national lockdown did. You'll find yourselves undoubtedly with an even greater funding gap than anticipated and required by the families and communities you serve to come up with answers for problems we haven't even encountered yet. This can only be resolved by a commitment from all towards a truly joint working scenario. We need Welsh Government, consortia and local authorities to engage properly and consistently with the profession. You need to know that public bodies are working with you to help continually assure safe levels of working across our settings. You need to know that our accountability systems and services, whether it's Estin or consortia, are similarly poised to offer proactive support to advance the cause of our learners. We're not out of the woods with regards to COVID, as this week's figures again indicate. We are still in crisis, and times of crisis call for collaborative partnerships, not punitive judgments or narrow ways of working. And in all of this, you may be assured your trade union is working and will continue to work robustly on your behalf. Many of you have been in touch over the last couple of weeks, sharing news and images of inset days and return to school scenes, which focused once again on teaching and learning. It's been an absolute joy to scroll through Twitter and see a return to questions around pedagogy being explored once more. You've been swamped with compliance management since March, and there's nothing like compliance management overload to suck the joy out of our job. But what this week has shown is that you've not only opened your schools, but somehow managed to return the focus back onto our core business again. Pupil well-being remains at the heart of all we seek to achieve. And you'll have heard me saying this before, it's a mantra of mine, it's our driver. And with leaders like yourselves at the helm, our learners embark on this term with all that might hold for them in safe hands. So I'm going to finish with 3 points. First of all, a thank you. Thank you on behalf of the families and the communities you serve, on the rest of the panel's behalf as well, for the terrific job you've done and for the promise of what's yet to come. I share the pride that Laura spoke of at the start. And secondly, a reminder, you're not alone. You subscribe monthly to a trade union body with over 33,000 serving members. Use it. Use our website. Use our advice teams. Use our communications. And if there are things you think we could be doing in a better way on your behalf, tell us. Stay in touch, because staying in touch means staying informed, and relevant, up-to-date information is what we're about. And thirdly, an instruction. And this is an important one, and I'm sure my medical partners on the panel will share with me in this. Take care of yourselves. Be kind to yourselves. You'll make decisions this term which will make such a positive difference for those around you. You'll make the right call, but there are times when you make the wrong one too. And that's okay. And you have to remember this, you're human. Share the load. We're often not good at sharing the load, but be sure to properly share the burden with your governors, with your leadership teams. Easier said than done, I know, but at times make the promise to yourself now that you will be realistic about what you can actually achieve alone, which is why you need to lead on your trade union and on the network that it facilitates. Thank you again for all that you're continuing to do.
Thank you very much, Ruth. And I know that those comments have been very well received in the chat comments there. And I'm conscious of the fact that we've taken up lots of our panellists and our attendees' time so far this evening, but I just wondered, Steve, if you had a couple of further comments that you wanted to make.
Yeah, I shall be brief because of the time, but can I add some thanks, please? First of all, for those comments and some of the key messages within it about wishing to work collaboratively. As a government and as civil servants, we don't start off every morning looking to upset head teachers or to that extent, other people working in education across Wales. We're committed to working with you. also, the Minister's asked me to pass on her gratitude and her thanks for the way in which you have set off at the beginning of this term, with many of you in many local authorities, a number of local authorities facing real challenges. You know she has championed your work and your staff's work historically, and she will look to continue to do that. I'd like to thank the Union for giving us this opportunity to engage, and we look forward to future opportunities to engage. At a personal level, I've missed the opportunities to directly engage with head teachers, which I've had for almost the last 5 years at regional national conferences. For me, they've been real, honest, robust discussions with shared interest in our children and young people in Wales and the staff that serve them. And while tonight has not provided direct contact that we would get sometimes between sessions or over lunchtimes or in some of the secondary head teacher conferences, occasionally at the bar, while it hasn't given us that opportunity to feedback, we've welcomed the chance to have this feedback directly from you. And I commit genuinely to taking this information and messages. Ruth and the team will, for those that I missed, we will have details to take back to the Minister. And as I said, we look at this as not a one-off. If there are other ways in which we can engage, listen, respond, then we'd welcome those opportunities. Thank you.
Thank you, Steve. Just to echo what Ruth has said before we finish, you know, you are the Union. And if you want to, if you're not a member of NAHT, you're interested in finding out how to become a member, or if you'd like to take a more active part within your branch, please do look at our website. But also throughout this whole situation, which is extremely challenging nationally, well, globally, but we're talking nationally tonight. If you do refer to the FAQs, and if you can't find what you need there, don't hesitate to contact the specialist advice line. And Steve mentioned future briefings, so we're very much looking forward to arranging some of them. They will be taking place. National briefings as well will be contacted to you, so keep an eye on your inbox as well. So it just remains to say thank you very much to all of you who've joined us this evening, and to all our panellists from Welsh Government and from Public Health Wales, to Ruth Davies and to Laura Dahl as well. Thank you, everybody, and good night.
Right.
Thank you.